Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. Unlike many medical conditions, HIV can often go undetected for years, leaving people unaware that they can transmit the virus unintentionally. In this episode, Nurse Zanele Cekiso, who works as a quality assurance nurse for an HIV testing program, emphasizes the importance of testing for HIV regularly to assist in promoting a world where HIV transmission becomes a thing of the past.
Thank you for having me, Candice. My name is Zanele Cekiso. I am a registered nurse by profession, and I'm currently working as a quality assurance coordinator for an HIV testing program in the district of Ekurhuleni.
Thank you so much for that lovely introduction. I think let's go straight into today's topic, the importance of getting tested for HIV regularly. So, Zanele, can you just mention and explain the benefits of getting tested for HIV regularly?
In this day and age, unlike previously, when you get tested, it is significant that you immediately start treatment. And how will that assist you? It assists you in a way that the moment you start your treatment as soon as possible, your immune system is prevented from deteriorating. So the earlier you get tested, the better for your health benefits. Let me say, if I do get infected and I'm not someone that tests regularly, it means it's going to take me a while to pick up the infection. I will actually have to have some sort of symptoms for me to pick up the infection of HIV. So if you make it a routine that you get tested regularly, it means you have greater chances of picking up the infection if it's there as soon as possible. And you also get to start your treatment earlier before your body takes a knock.
Zanele, just to come back to this to re-emphasize it, who is most at risk for HIV infection and what are the common transmission routes?
When you read our South African guidelines, you will hear of key populations. And these are the people that the guidelines are regarding as people who are at risk of getting HIV. But I believe that we are all at risk of getting HIV. As long as you are sexually active, whether you are using protection or not, you are at risk of getting HIV because we also have what we call condom-based, where a protection bests and it exposes you to HIV. Key populations are young people between the ages of 15 to 24, call them adolescents and young people. That group is called a vulnerable group because they don't have a lot of willpower when it comes to negotiating in relationships. We also have men who have sex with other men, and they are also regarded as a key population because of the lifestyle and also the mode, or rather like how they practice sex. Anal sex is highly infectious. We also have people who inject themselves with drugs, the period group. These are the people that use needles to smoke. They share amongst themselves. We also have sex workers. They are also regarded as people who are at high risk of getting HIV. However, I always say this, even us who don't fall on that description of key population, if I'm Zanele and I have multiple sex partners, or my partner has multiple sex partners, that means I'm at risk of getting HIV. Anyone who is sexually active, that particular person has risk of getting HIV.
So Zanele, how long after exposure to the risks of contracting HIV is testing accurate and effective to avoid false negative results, which can further lead to increased infections?
6 weeks for us as South Africa to detect an infection from a patient. But that does not mean the infection is not there. It's because of the mode or the kind of test kits that we are using as a country. So our test kits look for antibodies. They don't look for the actual virus in our systems or in our blood. They look for the antibodies, and it takes the body 6 weeks to develop antibodies for HIV. Hence, if I was to get infected today and I go test tomorrow or a day after, we might get false negative. We might get a status that says negative because my body hasn't developed antibodies that are fighting against HIV. So after 6 weeks is the only time where I'm actually going to get an accurate result. That's why most of the times if you go for a test, the nurse will say, oh, you might be on window period. So we call it a window period. You might be on window period. Please come back after 6 weeks. It's because of the types of tests that we use, it doesn't mean the virus is not in you.
Thank you so much for emphasizing those important points, Zanele. I think it's also important to find out the type of HIV tests that are available, including at-home tests.
In South Africa, we have 2 tests that we use. We have a screening test, which is the Toyo. We also have a confirmatory test, which is first response. So we test you with a Toyo. If it comes back and says positive, we have to confirm with a first response. These are the tests that we use in our institutions. So you can't use these 2 tests at your disposal or at home. However, the likes of Clicks, Dis-Chem, and other pharmacies do have what we call HIV self-screening tests. Those are not diagnostic tools. So if you test yourself, if you go and buy one of them, I think they range at around about 200 rands per test. So if you go and get one of them in one of these pharmacies that I mentioned, you can use it and test yourself at home. However, if you get results that are saying positive on that particular test, you have to go to the clinic so that you can do the conventional HIV testing, where a nurse or a counselor is going to test you using Toyo and first response. I also want to emphasize on this that the HIV self-screening test kits in South Africa, we don't use them as a diagnostic tool. We use them as a screening. So you cannot test yourself and you automatically say, I'm diagnosing myself, I'm HIV positive, and you do nothing about it. If it comes back HIV positive, you need to go to the clinic so that you can get the 2 tests done on you. And that's when we can say you are HIV positive. I highly, highly recommend the HIV self-screening tests, particularly for the people that, sometimes people have fear of walking to the clinic, just walking, taking that walk to go to the clinic. So I highly, highly recommend it for those kind of people who have that fear of the unknown. And some people, it's not a matter of they having a fear of the unknown, but they know what they've been doing. I always tell the counselors that our patients walk into our facilities and request these tests because they know what they have been doing. So it's easier to take the HIV test so that you can kind of prepare yourself before you walk to the clinic. By the time you walk to the clinic, you would know that, okay, my test has a possibility of coming back HIV positive, and I think I'm ready. So I highly recommend them also in relationships. If you are getting in a relationship and your partner probably says they don't have time to go get tested at the clinic, just go to Dis-Chem and get those 2 tests and take them together with your partner at home before you get sexually active.
What would you say are the emotional and psychological barriers to getting tested for HIV, and how can they be overcome?
The biggest emotional barrier for HIV is stigma, and stigma comes in different forms. There is external stigma, which comes from the community, and I think that's what we know most. But there is one that we call internal stigma. You are thinking that this is how the community or your family, let me say your community, that would be your family and people around you. You are thinking this is how they're going to perceive you, this is how they're going to see you. But actually, that's not how people are going to see you. It's you who is perceiving yourself that way. That is what we call internal stigma. It's one of the things that actually stops a lot of people from going to the clinic. The idea of getting sick. When you are living with HIV, it does not mean you are sick. It means you are infected with a virus that has a potential of making you sick if you do not take your treatment. So the internal stigma makes you believe that I'm sick, I'm not worthy anymore of being in a relationship with someone who's not HIV positive. Oh, I'm not going to have kids anymore. I think that is what stops people from going to seek HIV testing. The idea of knowing that you have HIV just terrifies people to a point where it stops them from seeking healthcare. And also, obviously, external stigma still plays a role. 40 years after HIV being discovered, it still does play a role. I just want to encourage your listeners to say, you might not be living with HIV now, but it's your responsibility to make HIV a topic in your own household. That's how we debunk stigma. If you and your mom, if you and your family, you constantly talk about HIV and demystify myths that your family members might have about HIV while you are not HIV positive. That makes it easier for you, if you were to be HIV positive, to then be able to disclose to your family, because you would have health educated these people before you were even infected. I think our biggest issue in the country is that we don't talk about HIV in our households. We only talk about it once it enters the household. And when it enters the household now, the atmosphere has completely changed.
Zanele, just to wrap things up, How can we reduce the stigma around HIV testing and encourage more people to get tested regularly?
I think we need to make it our day-to-day conversation. HIV should not be something that sounds or seems like taboo to talk about amongst your friends, in your relationship, at home, with your kids. We introduced PMTCT, which is Prevention to Mother-Child Transmission, in South Africa in the year 2000. That's when we had drugs that could prevent pregnant moms from transmitting the virus to their kids. If you look at someone who was born in 2004, that person is currently 20 years old now, right? It means a lot of kids who were born before that year might have been born with HIV. So if you, as a mom, as a parent, you don't talk to your own kids about HIV in your household, there's a high level of chance that your child is going to go out there and start dating, and they're going to meet a boy or a girl who was born with HIV. If you don't teach your kids to stigmatize HIV, your kids have a higher chance of getting HIV out there if they are not educated on it. And unfortunately, not everyone has an access to a nurse that's going to educate them about HIV. As adults or parents, we also need to take that responsibility of having that conversation with our kids. In relationships, you cannot start a relationship and not mention or talk about HIV with your new partner or even get tested. I emphasize that it is wrong as a listener, you're being in a relationship and going out on dates and sleeping with people without knowing their status. Please change that. Let your partner know from the onset of the relationship that HIV testing is something that you believe in and it's something that you would like him or her to also partake in. I mean, if you do that at the onset of the relationship, if the partner does not subscribe to that, then it means you can end that relationship earlier. I get patients who come in to test in my mobile clinic, and when they find out that they are HIV positive, they don't know how to go back and talk to their partners because they've never introduced HIV as a topic in the relationship. But if you have from the onset, it's easier to go back to your partner and discuss HIV statuses. So conversations around HIV will assist us to debunk the stigma around HIV testing.
Thank you for joining this week's episode of the Health from Zanti podcast. To find out more about being the healthiest version of yourself, visit healthfromzanti.co.za, or you can send us an email to hello@healthfromzanti.co.za. This is the Health from Zanti podcast, and your ears are always invited. In the fight against HIV, knowledge truly is power, and getting tested is the first crucial step. HIV can affect anyone, regardless of age, gender, or sexual orientation. But by getting tested regularly, you can shatter the silence and take control of your health. Stay healthy and fancy. I am your host, Candice Kumalo. Until next time.